Today I'll be telling you about how to prevent diabetes or attempt to prevent or delay the onset of diabetes. Mainly it is by doing a minimum amount of physical exercise, that is about 30 minutes of daily walk, and eating healthy foods. Avoid increased fatty food and try to burn the calories what you take daily. Certain tests can be done to see if there is diabetes, with onset of diabetes, like fasting blood sugar, which is done for 8 hours of fasting, or postprandial blood sugar, which is done 2 hours after eating your food, or random blood sugar more than 200 with symptoms of diabetes like polyuria, polydipsia and polyphagia. So it is better to always monitor this sugar level. Today I am telling you about 3 ABCs of diabetes mellitus. A is for HbA1c, which tells us about the sugars for 3 months, that is the average sugar for 3 months, which should be monitored every 3 months in a diabetic, and try to keep it at a level of about 7 for a good control. B is for blood pressure. A good blood pressure control in diabetes delays the complication of diabetes like renal failure. So the ideal blood pressure in a diabetic would be 140 by 80 mm of mercury. C is cholesterol. It is always better to keep the total cholesterol or the HDL below the normal range, and HDL cholesterol above the normal range, that is more than 40 in case of males and more than 50 in case of females. The target for LDL in diabetic would be less than 100. Today I am going to talk to you about diabetes mellitus. Diabetes mellitus is because of deficiency of insulin from the pancreas. So insulin is required from the pancreas to dissolve all the sugars from the blood. So deficiency of this insulin from the pancreas causes diabetes mellitus. So excessive sugar eating or sugar should be totally avoided in this case. Today I will be telling you about the types of diabetes. Diabetes, we have mainly type 1 diabetes and type 2 diabetes. Type 1 diabetes is seen in people who do not have production of insulin from the pancreas. This diabetes is seen in young individuals most of the time, and these individuals need to take insulin on a regular basis to convert the sugar into energy form. Whereas type 2 diabetes patient, wherein it is 90% of the patients are of this type, wherein there is deficiency in insulin or there is resistance of insulin. The production of insulin is there, but it does not act as it should act. So here we start them on oral hypoglycemic drugs. Another form of diabetes would be gestational diabetes, which is seen more often in pregnant ladies who do not have sugar before pregnancy.